Okay, good evening and welcome to the 78th session here at Virtual Shadowing. My name is Kiana Hunt and I will be your host tonight. Today I'm joined by Dr. Carrie Dutton as she shares her experience, how to survive health science training. As always, if you have any questions or concerns, feel free to reach out to us at virtualshadowing@gmail.com, and also make sure to follow our Instagram and our YouTube channel for future sessions. And also make sure to join our mailing group. Next slide, please. Here's our virtual shadowing group, which consists of Reagan, Aditya, Shayan, Ali, Miriam, Elena, Rachel, Rohit, myself, Taylor, and Ruth. And then our doctors, Dr. Fowler, Dr. Salazar, Dr. Morchetti, and Dr. Reno. Next slide. And here are our upcoming sessions. So we only have 2 left in this month, but we have a specialty spotlight in psychiatry and then another specialty spotlight in family medicine. You can join both of these on Zoom or YouTube Live at 7 p.m. Central Standard Time. And next slide. Okay, and then in this presentation, we'll have 2 question and answers. So make sure to put all your questions in the chat and one of our working group members will get to them as soon as we can. And I believe Dr. Fowler has some words before we begin.
It is so great to have you all back here. This has been a wonderful project for us. And on behalf of, I know all of you, I want to thank the working group who's week after week puts these talks together. It has been an absolute honor. There's clearly quite a need for it. We've had, of the 77 talks we posted online, we've had 500,000 viewings of these. So clearly these talks seem to make a difference for folks that are looking for a healthcare career. We're now about 2/3 of the way along in the admissions committee season here at UT Southwestern. And I will tell you that we are consistently now seeing students who are presenting virtual shadowing hours as part of their applications process. And we on the committee, we're pretty much treating virtual shadowing hours, at least right now during the pandemic, fairly equal to in-person hours. I don't know that that will always be the case, but at least right now, it seems reasonable that if you need clinical exposure, come on down to virtual shadowing on Tuesday evenings and come join us. I do have a thing I'm wrestling with is trying to decide if we should reopen the exams so that folks can go back to some of the older talks and take the exams. We're thinking about it. We're kicking it around. We would love to hear some of your input and feedback on that. So with that, I will turn it back over to Kiana. Kiana, thank you very much. Okay.
Okay, you're so welcome. I'm going to hand it off to Dr. Dutton. We're so happy you're here.
All right, good evening and welcome back, Next Generation Healthcare Providers. It is such a joy to be back with you tonight again. I just wanted to real quick say I graduated from Baylor in 1986, went to University of Texas at Houston Medical School, graduated from there in 1990, and did my residency at Vanderbilt Children's Hospital and finished that in the summer of 1993, which means I'm halfway through my 29th year of practicing pediatrics, which is really hard to believe. And I just wanted to say, as I put up here, 29 years in, I still find medicine to be fascinating, intriguing to me, thought-provoking, and rewarding. And I hope that you find that same, the same feeling in whatever part of medicine that you end up coming into. So when Dr. Fowler and the team invited me back, I gave them fair warning about 6 months ago that the best that I had for pediatrics, they got in round 1. And if I was to talk again, it really would be to just talk broadly to pre-med, pre-health, pre-OT, PT people on how to get through your time and years of medical training without experiencing your own personal heart failure. And so that's really what I'm going to talk about. And when I say your own personal heart failure, what I mean is that I want you to get through your years of pre-health training. I want you to get through them well. And I want you to get through them intact. And I want you to get through those years prepared. And I want you to get through those years confidently trained. I want you to feel ready for the job. And I want you to be a critical thinker. And so that is my goal of the times that I have just met with you and talked with you. All of those things. It's important to be well at the end of these years, intact, prepared, confidently trained, feeling that you're ready for the job. And as a critical thinker, I had an attending meet with me when I thought I was going to stay in Nashville before I decided to move back to Texas. And I remember he was part of a successful group. My gosh, I would have been 26, 27. He was probably late 40s, early 50s. And I remember him saying, I just want you to know, coming out of residency training, I don't want you to ever forget, if I had to pick a lawyer on an important case in my life, and this was their first case, or I had to pick a mechanic, an auto mechanic, and there was something really wrong with my car, or I had to pick someone to take care of my kids straight out of residency, I would pick straight out of residency. You need to know that you're well trained. You need to know that these years have given you what you needed. All right, I'm going to go on from here. Who you are matters in medicine. Your other passions and interests need to survive your years in medicine. And this picture here is just a reminder. Maybe you're passionate about painting. Maybe I actually play tennis, and hiking in the mountains is my number one destination for vacations. Maybe you have an instrument that you play. And I just think it's important that you go into the years of medical training and try to keep those other passions alive. Keep those, keep playing the tennis or being the artist or whatever actually is a passion to you. I actually think that we function better in an expanded state. And I don't mean to be mystic or Middle Eastern about that, but I think if our heart and our brain stays at a more open place, then we think better and we understand and we recall, we have better comprehension. And I think the other passions in your life that aren't medicine are part of keeping you in a more open thought process. And it will actually help you in all that you need to learn in medical training. I also encourage you to keep close friendships in your life that are not in medicine. That can be such a balance through medical school and residency or the other pre-health sciences. If you will keep relationships in your life that are doing other things in our world that also matter, that can be a great balance to you. I'm going to go back up here. The second point in this, your belief in well-being. I think medicine has taken not so good of a turn in the last 50 to 75 years. And it's kind of all about disease. And it's all about prescriptions. And I just want to give you a little bit of a challenge tonight. I challenge you to Google the word health, HEALTH, and look through several, maybe 10 different definitions of health. And then I encourage you to ponder, maybe write out on a note card, a couple of those. And as you're going through medical training, keep the thought process of health. And I wrote down this one on World Health Organization. I'm going to try to, there we go. I think I've got that. Let's see here, World Health Organization. This is their definition of health: a state of complete physical, mental, and social well-being, and not merely the absence of disease and infirmity. What a wonderfully broad definition of health: a state of complete physical, mental, and social well-being, and not merely the absence of disease and infirmity. And I encourage you to think about that as you're going through medical training, just keeping that in mind. Because if you think like that my ability to improve somebody's health isn't just about getting rid of a disease, I think it broadens who you are as a healthcare provider. We often minimize we maximize the thought of the disease process, and we minimize the thoughts about health, improving health. And I just encourage you, let medicine be big in your understanding and in your mind as you go through training. And I think that it expands. And I think having a couple of definitions of health that you relate to will make a big difference. It's interesting also. I'm going to see if I can show this well. Let's see. The adverse childhood experience, ACEs, ACES. So in the last 20 years, adverse childhood experiences, ACEs. In the last 20 years, there has been more and more study on the fact that traumatic childhood, like families full of anger or actual abuse going on, makes a difference in how your brain develops, makes a difference in the level of your stress hormones that your body puts out, and can put patterns in place that actually affect adult health. So they're beginning to understand more and more external influences, and they're beginning to, the ACE study shows the top 10 stressors in childhood or traumatic events. And then it actually shows those people who had that in childhood have a 44% increased risk of depression, a 28% increased risk of early heart disease. They go through the medical things that these traumatic events in life can actually be a part of and a process in. And it's those kind of things that we're starting to think about more in medicine, to understand that the environment around us, the interactions with other people, if they're positive or negative or outright abusive, that our body reacts to those. And your stress.
Hey, Carrie,
yeah.
Carrie, you know, the current youth, the youngest generation is the Gen Zers, and they have always had a smartphone. They've never not had one.
Yes.
And I have read that frequent smartphone use among adolescents and teenagers seems to be associated with increased risk of anxiety, depression, and even suicidal behavior.
Yes.
Do you have a comment on that?
I have a slide on that.
I'm going to be quiet. I'll be quiet.
No. It's you just jumped the gun just a tiny bit on that. All right. And I'm actually need to go past, I think the first question and answer slide is a couple slides before I was intending it to be. So they won't have seen the answers yet. So I need to go forward a couple and then I'll come back to the question and answer. If that's all right, Kiana.
Oh, yes, I actually fixed it. So I think if you go to the next one, it should update. Oh, never mind. Ignore me. Go for it.
Okay. I maybe I don't have the updated one, but this is before. So
Okay.
This is okay. So electronic media breaks. This is where Dr. Fowler was going. Interestingly enough, an entire generation that has basically had the on switch when you're talking about electronically. And I want to directly connect this to medicine. And Dr. Fowler would be well aware of this. Perhaps this is something we focus on a little bit more in the teenagers than the adults. But part of the concussion protocol, if I see a 12-year-old, a 17-year-old that's come in, football player, basketball player, smacked their head, lost consciousness, dizzy, lightheaded, still has a headache, like obvious concussion, they're not going to be able to work out in the next 2 weeks at all. But one of the things that's part of the actual medical concussion protocol, at least in teenagers, is that for the first 48 hours after the hit, they don't interact with electronic media at all. You tell them you can read an old-fashioned book, if you know what that is anymore. You can work on your homework sheets, like old-fashioned writing. You can, so old-fashioned books, magazines, those are all okay. And so what you need to think about, I hope some of you went, I wonder why is that? Why do you tell them to slow down on electronic media for the first 48 hours after they've had a head concussion? What we have now understood, and where Dr. Fowler was going, they do PET scans. So they now watch brain activity while people are doing different activities, while they're in conversation with someone, while they have electronics going on. And what they realize is that everything that has a screen, TV, your computer, your smartphone, everything with a screen, the electronic media actually causes your brain to work faster, to have to work at an increased rate and an increased speed compared to reading like an old-fashioned book.
Well, Carrie, in the resting state, all of you that are listening, all 155, excuse me, in the resting state, the brain consumes about 25% of the energy of the body. The brain is a high, and that's in the resting state. It is a high energy organ. And so then you do what you just said, have all these screens flashing at
Correct.
you, and the brain is consuming much more energy.
Correct. Yes. Yes. So I just wanted to bring in the medical point. Like if part of letting your brain recover after traumatic brain injury is that we ask you to stay away from electronic media as much as possible, that is your sign that electronic media is causing your brain to have to work at a speed and an activity. And as Dr. Fowler said, consuming more energy and glucose and from your system. And so your generation tends to have lived life on all the time. And I believe that it is because of that you're burning through your neurotransmitters, because you're in electronic media all of the time. And that there's a decreased chance of replenishing, which I'll come back to in just a moment. And so I think it's not in your best interest. And I'm gonna fill in the details on that in just a second. Being present is another point that neuroscience is doing some amazing things. Watching two different brains PET scans while people are talking face to face or in another room, or they're doing all kinds of fascinating things that they're figuring. And what they've discovered is that when you are engaged and in tuned and completely present with the person in front of you. And of course, we're talking about patient doctor in today's talk, but just even in friendships or marriages or whatever, but being present and connected to someone actually stimulates processes in your brain that bring healing and new synapses and different things form in a healing process in your brain. And so that's another reason to learn in patient interactions, to learn how to be present in those interactions. The third point here, replenishing your neurotransmitters. It is during time off of the electronic media, time in quiet, and time when you're asleep, that your neurotransmitters can be refreshed and can be replenished. And that is something that you guys desperately need, is time for your neurotransmitters to be refreshed and replenished. I had an eye-opening. I led a small group in 2019 of 20 to 25-year-olds. And after the first meeting of a 6-month, we were met every week for 6 months. I'll never forget, as everybody left, thinking they are as emotionally exhausted at 20 to 25 years old as my generation was in their late 40s. After chasing careers and having kids and running a household and that's when I really began to think about the fact of the electronic media and being on all of the time, the consumption of your energy that the electronic media is consuming. So I encourage you to figure out, even now in college, before you even start medical school, figure out how to turn your life off every day. I honestly believe if you turned off every electronic device for 15 minutes every day and just were quiet, just sat quietly or, looked outside at a view, that you would find your recall, comprehension, memory would increase after a couple of weeks of doing that. After a couple of weeks of giving yourself some time off, like put your brain in time out from the electronic media. That's really what I'm saying. I think that the next generation needs to learn how to allow their brain time out from electronic media in order for it to function in the way that it was created to function. And in order to not feel in a constant state of exhaustion, and as Dr. Fowler said, that they're now doing studies that actually look at the correlation between the number of hours a day on electronic media and the increased anxiety and depression. Like they're following that and they're doing studies. And so I think this is an important thing. And this is something you can start now, like in this year or two of you trying to get into medical school, or in this gap year that you might be in the middle of, you can start taking electronic time outs and create that pattern in you. And I do believe it's going to help your brain function better in medical school. Dr. Fowler, do you want to throw out any?
No, wow, that's just amazing. There are a lot of pieces to this. This really important picture at the bottom that you're seeing, folks, here about the chemicals involved in the nerve endings of the synapse in the brain, multiplied by trillions. This is an enormous number of cell connections that occur in the brain. And we really don't understand the brain. The brain is not a computer. We thought it was 25, 30, 35 years ago. It isn't. Probably the best summary, and Carrie, I mentioned this to you, I've seen about who we are in the brain is Nick Chater's book. And I put it on the website under Fowler's references, called The Mind is Flat, that what we really are in our brain is a collection of memories. One memory after the other, like a stack of Swiss cheese. and that's who we are. Well, you take an adolescent kid on a smartphone who's now got a covey of all these contacts that are very fragmented.
Yes.
The ultimate, and then you multiply that by years, especially when some of them are quite traumatic.
Yes.
Then the kid's sense of self, his mind coalesced as an individual, is really reduced, and putting that kid at risk.
Correct.
And Carrie, coming back to the thing, I love your idea about screen off time. Boy, that's so important.
Yeah. I really encourage you. I mean, you guys might go, well, she's just old. She's just her generation. But I'm telling you, if you follow the neuroscience coming out of your generation, if you follow the neuroscience coming out of scientists that are right now in their 30s, 40s, and 50s, you are going to be amazed at what they're discovering in the activity of the brain, in its need to have a break, in the importance of being see, the electronic media, not only does it cause your brain to work faster all the time, faster than it was intended to all the time, the electronic media also keeps you from being present, right? You went to dinner with a friend, but both of you are intermittently looking at the phone when you hear your phone ding. So you actually don't know how to have sustained being present with the person in front of you. And you need to do that as a doctor. I don't take my cell phone in with me. I know a lot of doctors have it clipped on their side or whatever when they go into patient rooms. My cell phone is on my desk. My family, closest friends know that I'll glance when I'm back at my desk. I'll glance to see if any important thing came through, but it is not going into the room with me. I am present with the patient mom and the kids in the room. And I can't encourage you more to start giving yourself electronic timeouts. If you have to start with 5 minutes a day and work up to 15 to 30 minutes over a year's time, great. Look at it as working out. If I wanted to run a half marathon in a year's time, I just have to start with a mile and then move up on that. And that's what you could start, just 5 minutes, turning everything off. Everything you have does have an off button. Okay. You might not realize
Carrie,
that.
on a related subject, there's another important book called Make It Stick by Peter Brown. And what it's about is about learning theory. Because on the one hand, when we're talking about stuff, with screen time and brain fatigue and so forth, the other thing is, well, how does the brain remember? This is all interrelated. And I will leave this very quickly, Carrie, only to say that Peter Brown talks about what's called interleaving. Think about weaving together theory about how we learn things. And as an old guy who just turned 69, thank you very much, I'm in the last year of my 7th decade. I worry about forgetting things, having just come off a busy ER today where I got my tail handed to me, trying to remember all the time in a busy clinical environment. And interleaving theory is very important. And I would encourage you all to take a look at that book. And it's also on the book reference list on the website. There you go, Carrie.
Great. Okay. Yeah. So it'll be interesting. I'm not so sure 10 years from now that a certain number of hours of electronic media use a day might not be part of the adverse childhood events. It might make the ACE list of things causing damage and increased inflammation and stress of your life, according to the number of hours per day you're on the electronic media. It would not surprise me if that is actually at some point added to what can actually, not allow your brain to work as well as it's supposed to.
And artificial intelligence, or as I like to call it, assisted intelligence, is coming in a big way.
Yes.
It's going to be all over our electronic medical records. For example, the Massachusetts Institute of Technology, MIT, just did a joint venture with Deaconess Beth Israel Hospital, inserting their AI program into the electronic medical record. And so I wonder if the way that we create and recall diagnoses and creating differential diagnoses, if the machine's going to start doing the work for us, where will our minds be about remembering?
Yes.
10, 20, 30 years from now.
Right.
Anyway, please go ahead.
Okay. I think I'll do one more slide and then go back to the question and answer. I'm not sure exactly where. So this next one, choose personal excellence. I can't encourage you enough how important it is to understand the organ systems and most common disease processes. Really understand them, not just memorize, but really understand the basic organ systems and most common disease processes. Because the more that you do, the more that you're going to walk in a courage and confidence that's going to improve your skill with patients. And I want to say, in medical school or pre-T or O2 or OT, whatever pre-health training you might be in, learning, this is so hard when you're trying to get an MCAT score and you need a GPA to even be looked at. I know what I'm saying is probably sounds impossible to you, but learning and understanding, when you get to medical school and residency, learning and understanding must become more important than grades to you. When you are in medical school and residency, it's important to understand and learn what is being portrayed in front of you, not as much what grade did you make on the test. And it's hard to make that shift, but it's important. And don't be lazy in training. I mean, if your thought process is how little work could you do in medical school and residency in order to become an MD, don't do it. Do something else. That's what I would say. If you're because you're signing up, your generation gets a label on them about being entitled. So what I would say to you, if you're going into healthcare, you're entitled to work hard in your pre-health training for the benefit of others. So you need to be able to be okay with that truth. That's what you're entitled in pre-health training. You're entitled to work really hard for the benefit of others.
I spent the afternoon, I went to work early this morning and just got off a little while ago, and busy. We had 200 patients in the department at one time. You're busy. And I spent a lot of time just sitting on the bed, holding hands and talking to patients. And, because terrified people don't come to see us in the ER because they're having a nice day. They come
Correct.
by and large because they're terrified.
Yes.
And so that you can help them with their fear, not destroy their hope, even when you have a pretty good idea that it's something terrible, so that you can be in partnership with them to help deal with their challenge.
Yes.
Anything other than that partnership is not a reason to be in medicine.
Yes. Very good.
And so enjoying the patients is so important. That's hard to do in places where,
yes,
they're clocking you about how quickly you're getting them in and
right.
getting them out.
Right.
That's a real challenge.
It is. I think the effort that's going to be most telling for all of you next generation healthcare providers, what's going to separate you out from one another in my mind is, will you put in the work to be a critical thinker? Or are you okay just following programs or protocols or something that tells you what test to order next. I hope many of you put in the work to become critical thinkers and really understand the systems and organs and disease processes, because that makes all the difference in the world on the kind of physician that you will be. We need critical thinkers, next generation healthcare providers. We need you to be critical thinkers, to want to be critical thinkers, to want to understand both the amazingness of the human body and the most common disease processes and treatments that are needed.
Carrie, Kevin just said, after your comment about moving patients through, Kevin said, metrics, the manager's administrator's best friend.
Yes. So press into understanding. I mentioned on my first talk a year ago, be the one that has the confidence enough to raise your hand in class during a medical school class and say, whoa, could you stop? Could you explain that in a different way? Because if you're thinking you're not understanding what the professor is saying, there's 55, if not 150 other kids in that class that aren't understanding what was just, and be bold. Like, it's their job while you're in medical school to be teaching you. That's their job. So don't feel bad about needing help. Don't feel bad about asking them to explain it differently. Step up and press in until you understand and can really think through things as a critical thinker. I like to look at medical basics, understanding the organ systems, understanding anatomy, the basic disease processes, like the alphabet. So if you didn't learn the alphabet letters, you didn't learn their sounds correctly, words wouldn't make sense. And if you didn't understand words, sentences wouldn't make sense. So there's a process, and medical school presents that process for the most part in that way. How normal anatomy and physiology is how this organ normally works. And then you move into pathology, the disease processes. And so the process of all that, it really does matter. And I'm about to say perhaps the harshest sentence of the evening. And I'm going to say it as graciously as I can. Someone presenting to your office or Dr. Fowler's emergency room with increasing sharp abdominal pain. Okay. In the end, that person doesn't really care how you're emotionally feeling today or what gender you're picking as your identity this week. What they want to know is, did you study well enough during your medical training? What they need from you is, did you study well enough in your medical training to help differentiate this increasing abdominal pain? Is this a kidney stone? Is this appendicitis? If this is a middle-aged woman, is this an ovary that's torsion of the ovary? Is this diverticulitis? Is this a tear in the abdominal muscle? And that can hurt with every movement. They need you to know the basic anatomy and the processes in that area. And so that's why you need to choose personal excellence in studying. In order to walk in courage and confidence, you need to not be lazy. Don't try to cut corners in medical school and residency. Press in to really understand things, not just memorize them, and know that you can walk with a sense of excellence. You really can, and it's going to be important both to you and to the patient in front of you. Let's see, Kiana, should I do back to the questions?
Sure. Let's swing in there. Are you doing fine? You need a sip of water, or how you doing, Carrie?
Well, we kind of have them in a little bit of a different order.
Okay. We're totally cool. We're here for everybody.
Yeah, take your time. You're good.
So Can I go on to the next slide or
Yeah, actually go to the next slide.
Well, I do want to give you it's not a question, it's a statement, but we put it in the question and answer, which is, you're awesome, Dr. Dutton, and so wise.
I love what I do. And if I couldn't do it with my heart, I wouldn't have done it more than 5 years. That's probably my honest answer. So personal interaction matters. And Dr. Fowler already jumped in on this one. He and I think a lot a lot when he was talking about holding hands in someone in the emergency room and trying to explain what you think they might have. How you interact with the patient in front of you portrays concern, compassion, and medical confidence. Not just the facts that you're saying, but how you're interacting with them has a lot to do with whether they are perceiving your concern for them, your compassion towards what they're going through, and medical confidence. And I think that medicine is quite amazing in the vulnerability that is offered to you as a healthcare provider. Someone sharing with you symptoms or concerns or fears can be quite personal, and how you are attuned to them and in the interaction makes a big difference. Attuning to your patient in other words, being completely present and seeing both what they're saying and the nonverbal cues in them is, I think, more important than you think, because sometimes it helps you to ask additional questions that can clarify the symptoms better. So I think it's learning how to interact face to face, eye to eye is really important. And it's one of the things I worry about in your generation, because if the electronic media is more comfortable to you than somebody seated 2 or 3 feet away, or even closer. If I'm listening to with you, a stethoscope is, I don't know, what is that, 18 inches long? So if I'm listening to your heart, I'm right up against you, looking in your ears, looking in your eyes, feeling your liver and spleen. That's all very close up. And I encourage you, if the electronic media and social media has wired you in a way that makes close interaction uncomfortable for you, I'm thinking practice. Like at Thanksgiving, go to Uncle Ted and say, could I interview you as if you had just had a heart attack? Ask you how you're doing, or I'm particularly for sure when you get into medical school, like use every holiday to listen to hearts of your relatives, to look in ears of your cousins' kids, to like the more normal you can see, the more normal heart sounds you're going to pick up the abnormal. The more ears you look in, you're like, oh, okay, that's not right. So the more chance that you have both in interactions with people, questioning and physical interaction, just practice on each other, practice on your relatives, practice on your boyfriend, girlfriend, like that. I want your generation to stay comfortable being present face to face, 2 or 3 feet from someone. You've got to do that if you're going to be a good physician, as far as I'm concerned. Carrie,
do you think that many physicians turn over to the electronic medical record and type with their back to the patient? And go ahead.
I think many have gotten in the habit of doing that for the sake of speed. We don't, at my practice, I'm thankful, neither the adult side or we have computers in each room because I show them the growth chart, and I could do that. So our electronic health record is set up that I could be typing things in the room. But I just don't. I want to look at this mom face to face, or this teenager. Yeah.
And let me comment on my style. I do exactly what you say. We have computers in all the exam rooms. We have 112 exam rooms in the ER, and they all have computers. And I never use the computer. I sit there, often on the bed, holding the patient's hand when appropriate. You have to measure the patient, how much contact they want and so on. But then I do what you said, Carrie, which is the fact that, let's say they've had a CAT scan or an X-ray, and I want to show them the picture because it's there on the computer. That's perfectly reasonable.
Absolutely. Yes, absolutely. I encourage you, and this, may be more of a talk of people in medical school and residency. Some of what I'm like, gosh, some of this you're not going to relate to till your third year medical school or when you're in with patients, but that's okay. These are things that are important. I think these are things that make you a great doctor. So I'm throwing them out out there, when you feel like you have connected and you've listened to the symptoms and you are explaining to the patient, well, so I think we're going to start with this blood work, and we might get an ultrasound. That may have to be a CT depending on it. When you have done what you feel like is a good job and you see no decreased stress on the face in front of you, and this is going to happen. Dr. Fowler probably has this a lot. Like you've done what you know to do. You feel like you've explained it well, and you still see fear, stress, and anxiety. One of the best questions you can ever have as a physician is this: to look at the patient and say, what scares you most about this symptom?
That's wonderful. And
all of a sudden you hear, well, my dad's brother had this symptom and it ended up being pancreatic cancer and he died 2 months later. Or my next door neighbor started with this symptom and like 6 months later, it was early Alzheimer's. So by recognizing that you've expressed what you think is most likely going on, what tests we might do next to hopefully figure that out. But it might not contain their fear list, is what I'm saying. And so asking that question when you still see stress on their face, well, what scares you most about this symptom, can open up a world of understanding. Go ahead, Dr. Fowler. You were.
No, I finished this quick note I was typing to a student. I really enjoy the connection with patients. I'm a single guy. I live alone, no kids. I watch reruns of Gunsmoke, and I read a lot, mostly online now. I just because it's available. But so I really enjoy the social connection with patients. That's just me.
Right.
You have to find, all of you online tonight have to find your space. But
yeah,
and so a lot of times, like I did today, you'll have a patient who's terrified. And I'll talk to them and I'll look at them and I'll examine them and then I'll sit with them and I'll tell them what I think, and I can still see the terror.
Yeah.
And I say, I want you to believe me that we're going to find out what this is. It may be good news. It may not be, but I'm still so scared. I know, but say, I love my doctor. I love my doctor. I go, all right, then we're going to get through this together.
Yes. And I mentioned in the first talk a year ago, this is going to be a matter that comes up way so much more for you guys. It just started in the last 10 years for me, when patients are showing me something on their smartphone or showing me a picture of something that they've already looked up their symptoms. So they're coming in and telling you, they want you to know the top 3 things it might be. You're going to have to figure out how to manage that as you live in the digital age and you're fully in it. And patients are going to be coming. The older patients still just don't look up something and they trust us as their physician. We're going to be losing that. I'm afraid. And that's going to be a great loss, but you'll have to figure out how to manage. And I mentioned this a year ago, at all costs, try not to be defensive. When I have a parent come in and they're like, well, we think it might be this, you just learn how to go, wow, well, that's a distinct and rare possibility. It would be more likely to be this or that or this. These are the 3 things I thought of first. And just try to have the conversation, not be defensive. It's okay for the family to have gotten online. That's the world we live in. And just try to stay in your lane. Stay in the lane of you having been a very critical thinker. And you can explain to them why you feel it's probably most likely one of these top, 3 things. And if you can do that well and not become defensive, then it's just good for both of you. And another one of these, I don't mean to be sounding like a neuroscientist today. I'm not. I'm just fascinated at all that they have figured out of the connection of emotion, our physical body, and how the brain functions, and medical illness, and how much all of that, how much we now understand emotion affects our stress hormones, that affects how our brain functions, that the stress hormones affect early heart disease. Like that, it's so amazing to me how all of that's coming together. And one of the other things that they are understanding in neuropsychology, neuroscience now is just because I am actively present and listening to the patient or the patient parent, in my case, usually in pediatrics, just because I'm completely attuned, present, listening to them, it actually, a patient feeling heard by their doctor releases healing neurotransmitters in their brain.
Absolutely. No
just
question.
because they sense you're listening to them. You don't have to agree. You don't have to think that the diagnosis they're thinking about is the one you're thinking about. You listened. And then you explained, and then you listened, and you still saw fear. And then you said, what scares you most about this symptom? In all of that interaction, which honestly, sometimes can all take place in 6 minutes. If they're honest with their fears, if you're confident as a physician, these things don't have to be prolonged. But in that, you literally, how you are listening to your patient, how you are engaging with them, how you're interacting compassion and concern, literally can release healing in them.
Hey, Carrie, Zara asked us a good question. What sort of class would someone take in college to work on becoming a more critical thinker?
Oh, wow. That is a great question.
Yeah, philosophy for one. Critical thinker.
Yeah, I think, I'm not sure about that answer. That's a great question.
That's a great question.
I think the answer for me is that through medical school, I was continuously aware, particularly in the lectures. I mean, I think I mentioned this last time when we went through the complement system and the professor started talking about C2, 3, 4, C3, 2, that complement this. I mean, I felt like I was in China and the professor was speaking Chinese.
And Carrie, there's 10 times the amount of immune system
correct.
Information.
Exactly. But,
oh God.
I mean, I stopped her. I literally lifted my hand in a conference room of 300 medical students.
I said, I have no idea what you just said.
And I said, I have no idea what, could you start that more slowly or in a different way? And I had 20 people after class come up to me and say, thank God, thank you for, so I think you train critical thinking by demanding to understand, by not being okay with just memorization. Like, don't just saying memorization isn't enough. I want to understand how the liver works. I want to understand how the body heals, forms a scar after we've cut ourselves. I really want to understand. If instead of just, there's a difference between understanding and knowing facts. And that is what you have to keep in mind. Don't just let knowing facts be enough. You need to understand the processes of the body and pathology, and it will so much expand medicine and make you such a better physician overall. And again, if you need to practice it, the electronic media for some people has really disconnected their ability to know a bunch of facts. See, this is what social media, and I'm not going down here very long because I have wonderful things I want to encourage you, but social media allowed you to know facts about someone without knowing the person. That's abnormal. That's abnormal. You shouldn't know a bunch of facts about me unless I shared them with you. That's what normal interaction is. So your generation is going to have to make their way back to that in the patient conversation and eliciting symptoms from the patient, and eye to eye and face to face is how you can see if they are understanding what you're saying, or if you can see that the stress is decreasing as you explain the steps that you're intending to take. You can see that on someone, and to respond to that by, it seems like you're still uncertain, or it seems like you're still afraid. So what is it that you're thinking about? What's making you afraid?
I do want to come back for one, and Carrie, I won't interrupt for at least 5 minutes, but I do want to come back to that thing about critical thinking, because I'm sitting here wrestling with the answer to that question. And I'll tell you, critical thinking for me in a big, busy ER for a guy who's been practicing for 40 years, who wants to get it right, involves two parts, really. And one is the willingness to realize the fact that my first impression is often not the correct answer to the problem. Number one. And that number two, I go back to the medical record at the conclusion, or as I approach the conclusion of my visit with a patient, and I sit down and I look at everything one more time. I call it my focus moment.
Yeah, that's a great point.
Well, I call it, and and this is where, the damn ER, the nurses are talking so loud, the patients are screaming across the hall. Both phones at the counter are ringing, and there's a consultant who's just walked up to me who wants to talk to me right now. And I'm in the middle of looking at all the lab work, the history, their past medical history, the previous medical records, to try to put it together one more time. And that's how I approach critical thinking, which is to clear the plate and take a last fresh start to it. Okay, I'll be quiet.
That's a great point. And what Dr. Fowler is saying without saying it is that he gives himself 60 more seconds to be present in just the information that has come back on this patient.
That's exactly
to be completely present and ignore everything else, present to the information on this, to see if it changes his thoughts, the order of his diagnosis that he was thinking by being present. Ray, let me throw something out and see if you think this is still true. Because I remember someone saying in medical school, let's see what it was. I believe what it was that 80% of the time, the symptoms, taking the history well alone gives you the diagnosis. 10% of the time, the physical exam changes or adds to give you the correct diagnosis. 10% of the time, both of those, it's going to need blood work or something else to give you the correct diagnosis.
I think that's probably pretty accurate. I mean, there's certain things, a guy could come in and say, I think I cut my arm off, it's in a bandage. You look down and on the physical, he has cut his arm off. Okay, well, yeah, he was right. But the physical, most people don't cut their arms off. Most people come in with funky chest pain, funky abdominal pain, headache. And the critical thing is to not assume that you know the answer. I had a patient very recently who came in with a history of lupus, and lupus, among other things, is hypercoagulable, which causes clotting in vessels, who came in with a little bit of a drooping phase and a little bit of dysdiadochokinesia, couldn't exactly touch like this. And I said, nah. Neurology came and said, what neurology does? I don't know. Get an MRI. And we did. And the patient had a stroke. They weren't unconscious, half paralyzed, but they'd had a stroke and they'd had weird symptoms. And so I think the last important thing is this, just to avoid being careless.
Yes.
Number one, if you're careless, you will hurt somebody. And number two, if you're careless, the quality control committee of the hospital will find out about it and you will get in trouble. And the medical board will find out also. So what ties those together? Saying, I refuse to be wrong. I will practice an excellent history and physical exam, order the right studies. And I will take a moment and I will figure it out.
Yes.
And through that, I'll be able to help somebody from here to there. Carrie, I'm hogging your talk. Please.
No. And listen well to your patients is what I would add. Listen well to them. They often will be your cue. The person, how they're explaining their symptoms, the next few questions that you ask. And if there's not assurance, all of those steps are a process and they matter. Yeah, they really, there are times when if you had finished the conversation with the patient and started deciding like which direction you were going to go, you would have either wasted time or had the wrong diagnosis. In one 15-second section of time, you ask one more question, or they just offer one more symptom that wasn't part of the conversation 5 minutes ago. Sometimes that's the answer. So just staying engaged and being present with the patient and interacting it's invaluable. Okay, do we need question answer time, or you guys need to kind of let me know?
Well, let's take a couple. You've been talking. Take a sip of water or something.
Okay.
Catch your breath, and we'll Kiana, why don't you take it away? We got plenty of great questions.
Sure. So you answered a lot of them through your wonderful presentation so far. But a question that I would like to ask is, how would you recommend someone develop a strong sense of work ethic and avoid cutting corners / making excuses?
Wow.
Yeah,
that's a great question. Can you build motivation and a hard worker into someone that isn't present by the time they're applying for medical school? That's basically what I kind of think you're asking me. And I think for pre-health people, maybe the perspective you could keep is that what you are doing really matters. Somebody's health is in your hands. That alone should be a reason not to cut corners, not to skip the lecture, not to study that chapter. Like, somebody's health and well-being can be in your hands. And that should be enough of a motivation to keep studying. And as I mentioned before in the other lecture, you're going to be continuously fighting off the feeling of being overwhelmed in medical training, medical school, right? You just feel overwhelmed all the time. And if you just keep telling yourself, like I mentioned a year ago, overwhelmed does not mean inadequate. Overwhelmed does not mean inadequate. Overwhelmed does not mean inadequate. If you can just start practicing that, then it won't knock you down by feeling overwhelmed. It won't make you feel insecure when you're just like, okay, I'm not going to let my feelings of being overwhelmed by the amount of information I need to learn in this chapter, I'm not going to let that equate to inadequate. And that is just something that you're, and maybe for your generation, you have to keep reminding yourself, like, my rereading this chapter again or listening to this might be the answer in a future patient visit. And maybe that's a way that you can, I don't know how you could make it through medical school and residency if you weren't a hard worker. I don't know.
Well,
what do you think, Dr. Fowler?
Yeah, there's a flip side to what you said, which was, how do you finally really get yourself to the point where you're willing to put the work in and really take the time it does to learn it? And I remember something my old daddy said, my old pappy, he said, people tell you all about themselves you ever want to know. You just have to pay attention. And if you are the 164 online with us right now, if it doesn't come out of you naturally that you are delighted to put in the work it's going to take to put yourself up as a candidate for medical school, then do something else.
Yeah.
Just don't
Okay.
do it.
I was gonna let Dr. Fowler say that, not me.
Well, because the thing you don't want to do, folks, is prepare yourself for something by working your tail off that takes years to get there, while borrowing $300,000 or $250,000,
Right.
which is that would buy a house,
Right.
to go into debt, and then find yourself 10 years out going, I don't like this.
Yes.
And you don't want to do that.
Yeah.
That's not a smart use of your time.
Right. And I think, a lot of the electronic media, again, it gives you a lot of answers without having to search through things. And so, don't confuse your Google search with my medical degree, right? They have a poster that says that. Don't confuse your Google search with my medical degree. There's a lot of truth. There's a lot of truth in that. But I think it's important to go into it just thinking, I'm going to have to work hard for this. And the reason for that is that it's really important, and that a patient's well-being and health could be in my hands one day. And that's worth working hard for this. I guess that's probably the approach I would do. Yeah.
All right. Next question.
All right, good. That was awesome. And I think something that even I've learned as I work as a medical assistant, also, And I've learned that one bad day doesn't equal a bad life or make you like a bad future provider.
Very
And so
good.
I think that it's just very important that you learn that everyone had to start somewhere and everyone
Yes.
had to learn somewhere. And
Yes.
so,
Excellent.
yeah. And so it's just very important to gain that understanding. And like, if this is what you want to do and this is what you're passionate about, then you'll work hard. And
Yes.
so, yeah. So that's what I've learned so
That's
far.
good. Yes.
And then,
Great stuff. That's great.
and then how would you say that like, your experiences shaped you into the provider that you are today?
Wow. Well, that's another great question. And I don't want people that didn't have this to feel like, oh, well, it's impossible. I'm dropping out right now. I had a very engaging family growing up. Like we enjoyed each other. We had great conversations, lots of laughter, lots of affirmation, lots of face-to-face time. And so that is natural to me. That feels natural to me to be 2 or 3 feet away from someone, engaging in conversation, talking very honestly, talking very authentically. And so that probably wired me to be able to do this well. And then just the pediatric side, I did a bunch of babysitting when I was in middle school and high school. I mean, I probably had 15 different families, made a lot of money. They would book me like a year in advance for their anniversaries and birthdays. And so I knew that I interacted well with moms and parents and the kids. And that kind of was something that led me into the pediatric side of things. Yeah.
Okay, good. Would you suggest our students like gain experience prior to apply, would you say?
Well, yeah, I mean that's why I was saying if you can tell that you're not all that comfortable in close interaction with people, try to practice it with relatives or neighbors, or like, can I come over and interview you like you're having some symptoms? Or I do think that you can practice being engaged and present with people if that's not comfortable to you. I do think you can practice it, as weird as that might sound.
Yeah. And then do you have any advice? This is one of our other questions. Do you have any advice on surviving like medical training if you are with children?
Yeah, that was a challenge for my peers that had little ones during residency, for sure, because the long hours that you're away from them. I think that the way that you would have to do that is to go into it thinking, I have these 2 sections of things that are high priority. So that's going to bring conflict at time between my kids and a 36-hour shift in residency. And you just, I would say you have to give yourself a break. And find the rhythm that works for your family. I don't know that there's one right way, except go into it going, this is possible. This is possible. This can be done, but it's going to be very difficult because 2 different things are going to be screaming that they're the highest priority in my life. And so you have to figure out how to manage that from the very first. Yeah.
Yeah, well, I think that is enough questions for right now.
Okay, so we'll go on to the next one.
Yeah, we'd love to hear more.
All right. Self-compassion develops patient compassion. I think this is something that most people don't realize at all. I believe that in order for you to be a compassionate physician for future patients that are in your care and standing in front of you, you have to be compassionate to you during medical training. I believe that if you just turn off your feelings and turn off, like, I just have to gut through this. If I just have to gut through medical school, it doesn't matter what's going on in my marriage, doesn't matter what's going on in my family, doesn't matter what's going on I just have to get through this. I just have to gut through this totally unconsciously and subconsciously. You're going to have times with patient families that you're going to be going, well, those are just minimal symptoms. They should just gut through that. Totally unconscious. You're not even going to be conscious about that. So I just want to say, be compassionate to yourself in medical training. If you will do that, if you'll be compassionate to yourself, in medical training, you will be developing compassion for patient visits ahead of you. I believe that will play out. And so the points that I go through, medicine is serious and weighty. It just is. There's no way to get around that, because a patient's life and health could be in your matter, but can be in your care. But you have two options. You can carry the reality that medicine is serious and weighty as an exhaustion, or you can carry the fact that training matters greatly because medicine is serious as an encouragement to energize yourself. It all depends on where you take that in your own mind and heart. It is serious and it is weighty. That can become an energizing factor to you to study hard and to want to understand things well, or it can be a constant source of exhaustion, and you just kind of can figure out how to work that out in as you walk through the years. And the other compassionate matter, and Dr. Fowler actually also brought up this point, is that patients are in a very vulnerable position.
Well, for starters, they come in front of a bunch of strangers and take their clothes off.
Yes. And the symptoms they're having might be very, very frightening to them, even though they seem not so much to us, but they're at a very vulnerable place. And I would say to you, next generation healthcare providers, that during medical training, you are in a very vulnerable place. You're constantly struggling with priorities in your life, the amount of information you need to learn, comparison and competition with other peers. That's a vulnerable place also. And
you're also often distracted. The baby ain't got no shoes. The old lady's on your back. The mortgage is due.
Yes.
You got a lot on your mind.
Yes.
And how do you take I think of it as a squeegee. How do you take the squeegee and just go
right,
and move it all out of your mind so
yes.
you can
focus
right there.
Yeah. And I think the second point, the second and third points are part of the way that you can do the squeegee, is recognizing your own unspoken fears about what you're struggling with in medical school. Whether it's to a best friend or a counselor or to a professor or an attending, just be honest month by month in medical school, how you're doing internally. Maybe it's just a journal, but I hope it's a person. I hope it's a close friend or a husband or a wife or a professor, or if you will be honest enough to recognize what fears are moving around inside of you, then you also are going to be more attuned to patient fears, and to just to be aware of almost a constant sense of fear of inadequacy that medical training can bring upon you, and to be in conversation with someone about that, and be an encouragement to other peers that are in your class. You can all go, wow, we all did so bad on that pathology test that like a 48 became a B. Like, that's not good, right? We all need to learn that chapter in pathology better. But I just think an honesty about your own unspoken fears are going to help you attune to the patient fears that eventually will be in your care. And a true sense of responsibility versus a false sense of responsibility is a part of medicine, not just medical training, but really medicine in general. And first of all, I want to remind you, you did not cause this patient's illness. So let's just start at baseline. When you're interacting with the disease process that they have is not your responsibility. So that part can just be taken off the table. Now, helping figure out symptoms and what test needs to be run and what all of this might mean, that's part that you can just gain in medical training to gain confidence in walking down those steps. And I encourage you to realize that how we do medical training in the United States is a safety net. That when you're in your clinicals, you're a medical student, and then there's a first or second year resident, and then usually a third year resident, and then an attending. All of those people are involved in the care of this patient. And let the safety net be a safety net for you. And so those that are further along in training, if you're a first or second year or third year medical student and there's a second year resident and there's an attending, again, just like I said in class, ask the questions. When you're walking down the patient rooms on rounds and you don't understand how did those symptoms lead to this diagnosis? How did they know what test to order first? Those are the kind of questions that you should be asking. Don't be the silent one on rounds that doesn't understand what's going on with the patient. That's a waste. It's such a waste of your time to have gotten into medical school and to be silently rounding on patients at 7 o'clock in the morning and not really understand how this ended up with this diagnosis or this treatment that's going on. Speak up. Speak up. Okay. Medical training is a hierarchy, which is a safety net for your well-being and for your education, and learn how to rest in that. What you have something, Dr. Fowler, you would add to that?
Oh, yeah. And then the thing I would add to that is that, folks, you're going to see 100 to 200,000 patients in your career. I've probably seen a couple 100,000 in my long career. You're going to be wrong sometime. It's going to happen.
Yes.
Because medicine is so freaking complicated. It's a headache. It's an odd chest pain. And the list goes on. I admitted a guy to the hospital recently who had a really crappy heart, but he was relatively stable. The problem was he slept on the sidewalk. He was a totally homeless guy who was a little worse in his congestive heart failure, but I probably could treat him with some pills. The thing is, where do you keep your pills when you're sleeping with your head against a curb? So I put him in the hospital, because the guy could have gotten hurt if I sent him out of the hospital.
Yes.
But you're going to be wrong, and you've got to deal with the fact that as long as you've done a good history, good physical, ordered the right imaging, taken that focused moment, developed a differential diagnosis, and done the best that you honestly could, then you can live with failure.
Yes.
You don't like it. And I'll tell you, the butt that I've kicked, Carrie, on the way home, from hospitals, is the one I've kicked the hardest is my own.
Yeah. Right. Yes. Yeah. And the other thing that we don't, I don't think that we emphasize enough in medicine is that because people's bodies and their organs are different. We're not all the same. We're not like the pieces of a car being put together by a mechanic. That's why symptoms can present differently, and it can be confusing, and you are going to miss things, as Dr. Fowler mentioned. And that just, you're not perfect. You're not always going to do things well. So tonight we give you freedom, next generation healthcare providers. We give you freedom not to be perfect, to go into this knowing you're going to make mistakes. Training is a time where there's a safety net around you. Training is the best time to make mistakes because often someone else is looking out for things. And medicine continues to be a wonderful place to be if you put in the work for the training, but it all doesn't work perfectly. And that's just part of the art of medicine rather than the science of medicine. Yeah. Wow. All right. So this next slide may get me in a little bit of trouble, but that's okay. I wanted to shake a little bit this COVID zone that you have survived in up to this point, that you're trying to get into medical school or pre-health. So here's my title. It's not all about COVID. It's not going to be all about COVID. By the time you finish medical school and residency 7 to 8 years from now, there may be no COVID left as far as this type of thing. So I'm sorry, this is blurry, but I wanted to just show you the CDC, NH that put out a vital statistics. You can look at 2017, 18, 19, top 10 causes of death in the United States. So here we have heart disease, cancer, unintentional injuries, chronic lower respiratory, that'd be like COPD, stroke, Alzheimer's, diabetes, kidney disease. And so these are the processes you still need to learn about. When I say it's not all about COVID, I mean that all of the other things that cause illness, disease, and loss of life and loss of health and loss of vitality in people, they're still out there. The heart disease, cancer, injuries, stroke, it's all there. You need to understand those processes. And I also want you to understand, because again, we're in the COVID zone. I want you to, when you look through this, only 1 of 10 is infectious disease. Right? Everything's infectious disease right now because it's all about COVID. But when you look at the overall, and if you looked in the childhood one, it would be congenital malformations, pediatric cancer, asthma. So it would have its own list. But I just want to try to keep that in perspective. You still need to learn. In fact, maybe every once in a while, pull up 2019 vital statistics for adults and pediatrics on the top 10 causes of disease or death. And just keep that in mind, because all of those things are still around. All of those things will end up probably fairly soon, within a year or two, of killing more people than COVID. And I just want that perspective to be where it needs to be in this odd place that the last couple of years have been. And the fear and stress that the pandemic has caused has pretty much accelerated or worsened most of these top things. So fear and stress can accelerate heart disease, can accelerate cancer, suicides, stroke. All of those things can be accelerated by increased stress. And I really hate that on this pandemic of fear that we're in the middle of. I want to put another perspective about pandemics. If you have the chance, look up the Spanish flu. That was the last worldwide pandemic that we talk about in 1918 through 1920. At that point, there were 1.8 billion people on Earth, 1.8 billion. It is estimated that 500 million, so about 30% of the population, had cases of the Spanish flu, and there were between 50 and 60 million deaths. Yes, between 50 and 60 million worldwide deaths from the Spanish flu is the estimation. And here we are 100 years later, and one of our greatest problems is we have almost 8 billion people on Earth now. So we have an immune system, as humanity goes, that functions brilliantly. And you are exposed to the illness, or you get the illness, you might get seriously ill, you might die, you get immunity, and things bounce back. And I just really wanted to throw that perspective out there, because you've so much it's all been about COVID, and it has stolen years of college, and you couldn't get to labs, and you couldn't sit next to someone in class and ask them if they understood what was. There's just so many things that have been unusual about your college years of going into health training. And someday you're going to go, wow, my goodness, all of that it consumed. But the other disease processes you need to understand all of the rest of that in your medical training. Do you want to say anything about that, Dr. Fowler?
No, man, I'm just sitting here thinking about it. I put it also in the reading list, John Barry's wonderful book, The Great Influenza, and just what a disaster it was for the planet. And all they had was masks and social distancing, to try to deal with that. It was awful.
Yeah. I mean, there were no IV antibiotics to try to help with the pneumonia back then, or IV fluids, or and now we have 8 billion people on Earth. So I just wanted to I'm not trying to minimize COVID. Many lives have been lost. Families have been devastated, but I would say just as many families have been devastated by our reaction to COVID, shutting down schools, jobs lost, and the acceleration of other illnesses. And so I just want to keep that in perspective. And now this next slide may really get me in trouble with the next generation, but I think it's important to deal with. You are not all mentally ill. Next generation. young next generation, somewhere you have believed a connection or a lie that feelings of stress, tension, and effort equals anxiety and depression. I want to say to you, stress, tension, and effort and uncertainty, stress, tension, effort, and uncertainty are normal parts of life in different seasons of our life. We are uncertain at times about a job or whether to buy that house or different decisions to make. That's a normal part of life. Feeling stressed, feeling tension, feeling insecure, feeling like something's demanding more effort from you than you expected should not equate, oh, I must be anxious or I must be depressed and I need to be on medication. I am dismayed by something like 20% of college students on anti-anxieties and antidepressants. And you're not even in medical school yet. I don't know. I go, how's all this going to work? Like when the real stress of medical school and residency. And so I don't know how to tell you to relate more normally to stress, tension, insecurity, uncertainty, and effort. But I just want you to begin to learn how to relate more normally to matters of stress, tension, feelings of insecurity, feelings of inadequacy, and not to just make the jump. Oh, I must have an anxiety disorder. I must be depressed because I'm not feeling certain about this or that I can do this, or somehow we need to get a different perspective back, particularly before you're all the way into medical school or residency, because it just has its own level of things. Dr.
Hey, Carrie,
Fowler,
I would also add that self-medication is not required to get through your 20s, namely smoking marijuana, drinking a lot of alcohol, and so forth. And folks, listen to me. If you have an issue with that now, you're using any kind of psychoactive substance on a regular basis, you be careful, because you may not get in professional school. For example, if you are found on a campus with marijuana and it's not allowed, it's illegal in that state, for example, or as one of our schools like Rice here in Texas, if you are found with a beer can in a dorm room, that is a violation. Folks, you have to report that. That has to go on your application and what you did about it, and say, I was found with that. And while I don't drink, I took the penalty and I've realized that I have to show more discretion in the future. Folks, you don't want to have to put that on an application, because that'll put you in a second stack probably almost immediately. So please,
Wow.
If you're going to work as hard as you are working and you're having an issue, you're using a lot of substance, you need to look into that. That means something. And so be careful. Be careful.
Yeah. Oh my gosh, Dr. Fowler, I am so thankful that you brought that up. Not just prescription anti-anxiety or depression, but all the other illicit medications that you can be using to try to feel more calm. And you know, I'm going to assume that probably medical schools and residencies are going to have set in place probably more counseling services, or are going to have to separate you into small groups that meet once a month to talk about the stress. I think the level of your exhaustion, the level of the neurotransmitters that have been burned through from the electronic media and social media in your generation, in the next generation, that somehow is going to require some stress, tension, and some increased effort and watching out for in the medical schools and residencies, if it isn't already. But it's going to be a situation. And if I don't know how to say this the right way or to say this well, but if you're operating in a place already in college or high school, like Dr. Fowler said, that a substance is needed in order for you to just function through the day. And of course, hey, listen, I'm going to take the number one conviction on caffeine here, or I'm totally addicted to Diet Coke, probably killing me faster than real Coke would.
Carrie, there is nothing adverse published about caffeine, including today an article came out talking about the reduced incidence of kidney stones in people who drink a lot of coffee.
Oh,
And that
wow.
would,
All right. Well, I'm never going to have to
would,
deal with kidney stones.
and that would be me.
But
please
but
go
this is a real thing. I don't want you to be condemned by a title that says you're not all mentally ill, but there are just, it's like there are forces in our culture that are trying to lead you to believe that if you have any bit of stress, any bit of tension, any bit of feeling of inadequacy or uncertainty about life or how you see yourself, then you must be anxious and depressed and you need to get on medications. There's just forces around you and in social media and electronic media that are pressing you in that direction. And I just want to be someone that says, that's a lie. It's a lie. Some stress, tension, feeling of uncertainty, feelings of inadequacy are normal parts of life. If you're a responsible adult, it's normal part of your closest relationships, normal part of job changes, just normal part of big decisions that you make in life as an adult. Those are normal. And there's some element of the constant speed of the electronic media and the social media. There's some element of that pressures these other things more. I think keeps them at a heightened place of stress and tension, and the social media just fills you with comparison and competition, and just can be so vicious to who you are. And I you know what, I guess I'm encouraging you, like, wow, either figure out how to be really painfully authentic and real with some close friends in college, or go ahead and get some counseling services at college. It's usually included, I think, at the price. Just do what you need to do to be at a healthy place when you're applying for medical school. That's what Dr. Fowler and I are trying to say. Do what you need to do to be at a healthy mental, emotional place heading into medical school, and make sure substance abuse isn't a part of you thinking, I could do this as long as I can smoke pot every day, or I can do this as long as I, can get hold of some speed, or I can do this as long as I can, like that. That's just not, that's not going to work for you. It's not going to work for your patients, for sure. Anything else you want to say about that, Ray?
And we don't mean to sound like grandpa and grandma here.
No, we don't.
It's the fact that it is clearly apparent that young professionals can find themselves having an increasing rate of the use of mind stimulating substances.
Yes.
Whether it's something legal like alcohol, or in the state of Texas, marijuana is not legal. And I recently had a candidate that in a state where marijuana was not legal got busted for pot in a pocketbook, plus a couple of pipes. And then applying to medical school, this person has worked so hard and just pull the rug out from under them. So, I'm just telling you, folks, you all are going to be working really hard. Just look yourself in the mirror and be honest about who you are and what you're doing.
Yeah.
And if you're altering your mind with something, you need to think about this, not just for a medical career, but for the future of your life.
Yeah.
And that's the truth. I watch people drink themselves to death every day. And that doesn't need to be you.
Yeah. And
I'm sorry.
Yeah, no, for some of you, you might need to consider, if you're in the process of applying to medical school or OT or PT or all the pre-health things, you actually might need to consider like dropping your social media for 6 months. Not only giving yourself electronic media breaks 15 minutes a day or more, but just dropping your Facebook or Twitter altogether. Like, because all of those people's opinion of you probably is not going to help you get into medical school. All of their comments that they might be saying, I mean, we're not trying to be cruel, But the patient sitting in front of you, they don't care how many followers you have. They don't care if you have a thriving blog. The patient or patient parent that's trusted me with their child that's sitting in front of me 3 feet away wants to know, did I do the work to understand what might be causing this 103.5 fever in their kid? And can I assure them, if I feel like it's just a routine viral illness and it doesn't need any blood work, I don't need a chest X-ray, or did I do the work to critically understand normal organ function, disease processes, treatment options, and how to interact with a patient well? Did I do that work? That's what they need from you. That's what they need from you. And your electronic media, or for sure your social media, I don't think it's going to be that helpful. And you might need a break. You just might need a break. All right. You want to say anything about that, Dr. Fowler?
No, I couldn't add to that at all. Please keep going.
Yeah. I mean, I don't mean to bash. I really don't mean, I mean, this virtual shadowing exists because of the beauty of the electronic media. That in the middle of a COVID pandemic, and those of you trying to get into medical school and needing hours to even have your application looked at, needing shadowing hours, like this worked. These 80 episodes have worked, and they're available to you, and you can learn a great deal, I think, from most of the physicians that have been on it. This is a beautiful expression of electronic media. Okay, so
and you got med schools that are actually looking for shadowing hours. This is my 10th year on the admissions committee, so I've got a lot of experience. I don't mean about me, but I'm just telling you,
yes.
I've been around.
Right.
And 10 years ago, we weren't looking at shadowing time all that much. We
Correct.
absolutely do now.
Yes.
And we want to see 50 or 60 or 70 hours of shadowing. Well, we've got 130 hours of virtual shadowing online or more now.
Great.
And
yes.
for me to see a candidate, as I have recently, submit 10 or 15 hours of shadowing time, I go, you know what? I know that we've got 100 hours
more
out there.
Okay. Yeah. So, we really are not trying to bash electronic media or social media, because it can be amazing when it's working well and when it's improving lives. It's truly amazing. But your entire generation, I mean, basically, if you were born after 1995, for most of you, I think the electronic media, and for sure the social media, has been more destructive to you than affirming. It has caused you more insecurity in its comparison and competition than it has built you up. And that's the switch that we need to figure out how to flip. For some of you, you're just gonna have to get out of it and take a break from social media and figure out who you are, and decide that you can do this, and that you want this, and that you want to work hard, and that you want to realize that oh my goodness, if you could understand the value of you as a human and me as a human, then you would understand how invaluable every interaction with a patient family is, and a patient in front of you. They are unique, unlike anyone else. You are unique, unlike anyone else. So the two of you together in that patient visit are having an encounter, unlike, unique, and specific to any billions of person-to-person encounters that have ever occurred in all of humanity. That's what's going on with you and the patient. That's mind-boggling. That's astounding. I get to have unique, specific patient encounters every day that no one else is going to be a part of. No, if you can keep that in your mind, that if you can go, like, it's actually an honor to be the physician in this encounter. As you do that in your own mind and your own heart, I actually think it connects the patient in front of you to you, all subconsciously, the neuroscientists would say. But yeah, it should never be boring to you. The disease processes, there's sometimes in a normal winter when I'm like, oh, if I hear another RSV cough, or if I have to see another ear infection, there's seasons of times that you're seeing a lot of the same thing. But but there's also a great deal of amazing, wonderful variety in medicine. As a healthcare provider, I think we have more variety. And if you think about the person in front of you as a different human to human encounter than any other one you will ever have, then that alone can make can bring a perspective. I think that can encourage your heart. And in the end, I want to remind you that it's the patient in front of you is a person, not a disease. There's a person in front of you, not just
you know that may be the most important line you've said this evening, is that, and I believe in the connectedness with the people that we serve for a lot of reasons, one of which is purely selfish. I find it pleasant, entertaining, interesting. I learn a great deal.
Yes.
It helps me with the fact that I try to kill off my ego and not think that I'm such a great smarty about stuff. And and I think we must welcome those interactions with people, Carrie.
Yes. and in an equal manner, equally important. I believe it's equally important to remind yourself there's a person in front of me, not a disease process. And you must remind yourself that you are a person, not just a doctor. Both of those are things that need to be balanced well. I need to honor this as a person who has symptoms, who has a problem, but it's a person, not a disease in front of me. And you need to go, I'm not just a doctor. I'm a person with other passions, other interests, other priorities, and keeping those in mind can be really important. If you have to practice a sentence, if I wanted to give you one thing, that when you're showering in the morning on a day in medical school or residency, look in the mirror and say, I can become well-trained today. I am becoming well-trained today. I can become well-trained today. I am becoming well-trained today. Start off with that positive perspective. Today, my classes in medical school, or today, the rotation I'm on in residency is giving me a chance to become well-trained. That can begin building a sense of confidence and courage in you. That's going to make you a better physician overall.
And Carrie, the other piece of that for me, as someone who continually trains, but is the fact that when I'm taking my shower in the morning, I'm saying to myself, as I'm rubbing the sleep out of my eyes, I'm saying, oh, I got to go to work. And I go, it's the best thing I do. It is the best thing I do in my life. And you know what? What a great thing to be driving to work knowing I'm about to go do the best thing that I do.
Absolutely.
It's purely personal, folks. I don't want anybody to about what I do. I'm stupid about a lot of things. Mm-hmm. But I talk about there are one of three reasons why I may not know something when I'm seeing a patient. I either never knew it, and there's plenty of that, or I forgot it. You wait till you hit 69. There's plenty of that, or it's new stuff. And folks, holy mackerel, the rate of change of medicine now is astonishing.
Yes,
it is an increasing slope of the rate of change of information.
Yes.
Please go ahead, Carrie.
Yeah. And I think that's the rate of change of information, the fact that there's 20 times more information understood than when I went to college and medical school, or Dr. Fowler did, is one of the ways that the access to the electronic media is going to save you, because there's so much more information, but it will not, cannot, and do not let it replace truly understanding basic organs, anatomy, pathophysiology, disease processes. Do not, you just have to, and patient interactions cannot be replaced by just electronic media or fax. It just can't. And it shouldn't, and you shouldn't want it to. I don't want you to feel confident without thinking that you can interact well with a patient and you can hear them. And if you still see stress, you can say, what scares you most about this symptom? Like, those are all things that can make you such a great physician. And Dr. Fowler and I both, you can tell we get energized with patient encounters. And you can do that. You can do that. And it can help with the overall exhaustion and overwhelmed feelings of medicine. And again, you can just remind yourself, I'm becoming well-trained. I have lots of hours of conference today, or we're going to be slicing open the heart on our cadaver today. But all of this is part of the process of me becoming well-trained, and I can become well-trained.
Carrie, all of us have stresses and strains in our life at different phases, whatever it may be. Pick the phase of life,
Yes.
building a house, borrowing money.
Right.
I mean, the list goes on. And one of the things that has struck me over the years, and I run a division of emergency medical services I'm the chief of the division here at a large university, full of stresses and strains. And yet I walk down the hall and go into the room and close the door and say, I'm Dr. Fowler, and what's going on today?
Yeah.
Who's the patient? Who's the patient in here? And brush that all behind of
Yes.
all those stresses and strains. Just put them back here and focus on the clarity of that interpersonal, very special interaction.
Yes.
I find that has been one of the most healing and uplifting is a word, but probably strengthening things in my life is that, number one, I can push the stress out of the way. But number two, this is my choice. I make that interpersonal interaction principle to work
Yes.
to the encounter,
Yes.
encounter.
Yes. Yeah. That's a great point. It again, in our type of present medical training, you can get focused on getting the right diagnosis and the right prescription and totally minimize the personal interaction that just took place to arrive at the disease diagnosis. Don't do that. The steps of talking with the patient, finding the symptoms, the time frame of the symptoms, what started first, and then what was the next symptom, and at this point, what's bothering you most still? Like, those are everyday questions. Or with a parent, I'm like, okay, how many days ago was the first symptom? Okay. And then at this point, what are the symptoms that are still remaining? If the child's old enough, I'll look at the 10-year-old and go, what's bothering you most today? And they're like, oh, it's still my sore throat, or it's a headache, or all of those steps are important part of medicine. They shouldn't be skipped. A computer shouldn't do it for you. and they're energizing, even doing them all day long, as Dr. Fowler said.
Right. And Carrie, there are a lot of diseases that look alike.
Yes.
And some of the ones that look alike may not be all that serious, but they really look alike.
Yes.
And especially on a busy day, you've seen 30 patients, your feet are killing you.
Yeah.
You've got a pee, you're hypoglycemic, you've got a lot to do, and you need to get to the PTA meeting, and you've got another one that looks alike, but it could be serious.
Yeah.
Are you going to find that? And that, folks, is a challenge. That is a challenge.
Yes. Yes.
I've been there.
Yeah.
There
Absolutely.
are a couple of cases in my career, Carrie, that I wish I could get back.
Me too. Yeah. Oh, absolutely. Yeah. Not very many, but there are a few that it was like, wow, I missed that. And they ended up in the ICU in children's. I mean, it does. Thankfully, there are not very many, but there are.
Right.
Yeah. Yeah. So that's part of it. So I'm going to basically end where I began with this that just says, if you keep this in mind, if you work hard, if you learn the processes, if you train yourself to enjoy and appreciate the patient physician interaction, or OT or PT, then medicine can 29 years later be rewarding and fascinating and intriguing and fulfilling. And it is. So, today's talk, my goal was to be a bit of a cheerleader, mentor, life coach, personal trainer, counselor, a little bit of all of that in the life of those that are pursuing pre-health training, because it is intense and there is a lot. I'm just going to put this up as far as if you want to contact me, speaklifeng@gmail.com is where you could get hold of me or send emails. I got a lot of them after last time, and have continued to interact with 25 or 30, even a year later. And then this website, speaklifeng.net, is the one that I put together just to encourage the heart of the next generation, those that are born after 1995. So anyway, that's it from me. If we want more questions, can open up to questions.
Let's do a couple. You're so special. Let's do a couple. Okay, Kiana, pick a couple.
Okay, sure. So I think the question that stood out to me is what other stuff, I guess, they're regarding what they should look into before they decide that medicine is the right path for them, even without experiences.
Okay, so there's two different ways I'm going in this. Wondering, are they asking about becoming a physician versus nurse practitioner or PA, a mid-level versus a physician, or like going into healthcare at all versus business degree or something. So let's talk about just going into medicine in general at any RN, PA, NP, physician. You've got to be fascinated by science. Like if you're not fascinated by science, if you don't actually understand that the complexity and integrity interaction of the human body is like the most fabulous, amazing, complex computer system that's ever existed. If that doesn't fascinate you, if that thought doesn't fascinate you.
Well, moreover, in 1973, in August or late July, when I started medical school, they handed us a Xeroxed article from that famous medical journal, Scientific American. That's a joke, folks. That showed the trilaminar cell membrane had just been described. And the coagulation pathway was a little Y like this with a couple of little things, and that was it. Today, the enormity of cell membranes and the proteins that lie within and the receptors and so forth is so vast. And the rate of change is so fast. If you're not interested in science, you're in the wrong field.
Yes, for sure.
And because especially if it's something that's anything clinical, say other than say psychology, where you're sitting at the, in a chair talking to folks, but even then they may be on medications.
Yes.
And so it's got to be lifelong study. Otherwise you will be so far behind so quickly.
Yeah. Yeah. I mean, I just since you can Google anything now, I mean, Google electron microscope of a cell, just that. And like Dr. Fowler said, and now we see the 50 different layers and levels and different factories basically in the cell making proteins. It's just in something that's so small we can't even see it. I mean, if that doesn't just make you go, wow. And that we have however many trillion of those cells in our body. And then our body makes new red blood cells and lets the old ones die after 90 days. And it's just, I like babies can have mucousy eyes because right in between the middle of your eye and your nose is a tear duct. It's the reason that when you cry, your nose runs, because there's a small little muscular tube between the middle of your eye and your nose. It's one of the 1,000 things that your body's doing every day. In the newborns, it can get sucked shut like a drinking straw. So they start getting mucousy yellow eye, and the parents think they have pink eye. They don't have pink eye. It's totally anatomic. You train them on how to massage the up and down on the side of the nose 3 times a day when they're changing the diaper. It'll pop open. It'll start working again. The tears will go where they need to. But it's literally when you look at someone who's a successful businessman who's 45 years old bringing their kid in, and they're like, oh yeah, I never wondered why our nose runs when we cry. Yeah, well, because there's a connection there. There's a muscular tube that connects your eye, and it lets excess fluid drip down the back of your nose, because our body makes fluid to keep our eye moist all day long. So extra ones drip down the back of our nose. One of a million things you don't even know is happening every day in your body. That's how incredible.
So, Carrie, I have to ask you, just in all humility here, I've never changed a diaper in my 69 years.
Wow.
Have I missed much?
Well, I get coughed on, vomited on. So that's
I get coughed and puked on. No.
Oh, okay. But it's just, if you're not fascinated with medicine, with science and the physical body, go into something else. Now, I've had a couple of people shadowing me recently. I've had 6 this year, and one of them specifically asked me, how do you know whether to just be a mid-level provider? How would you know if you're going to be completely content being a nurse practitioner or a physician assistant rather than a physician, all the years of medical school and residency? And, I didn't have an immediate answer for her. I kind of had to, and I found myself all the way back to critical thinking. If you're okay about punching symptoms into a computer and it tells you what the 4 most common things are and what labs you might order to do it, don't go through 4 years of medical school and 3 to 5 years of residency.
Because you don't need,
if you're content for that, then I would say you don't need to do the whole process of medical training. But if you truly want to think critically through the process, I mentioned a year ago, one of the things somebody said to me in medical school that was so helpful, when you're listening to symptoms or learning disease processes, and I still use this to this day in pediatrics. What are the 3 most common and the 2 most serious that this might be? So the 3 most common illnesses, these symptoms, the kids might be 103 fever, cough, whatever. So the 3 most common and the 2 most serious, these symptoms might suggest. And in that, you are probably going to capture 90% of diagnosis in that thought process. So that's kind of a good one to hang on to.
Yeah. Well, Carrie,
what would you say about whether all the way to physician or mid-level, Ray?
Well, Carrie, I worked with a PA today who was absolutely wonderful. And the thing is, there's a great deal of medicine that can be learned on the job, especially if you restlessly, I guess you could argue that a lot of it is learned OJT.
Right.
But if you will restlessly pursue this particular thing, if you will read about everything you don't know when it happens, or as soon as you can, write it down and look it up later, and you will always do that, you can be trained from about any level.
That's true.
The PA I worked with today, I treated just like one of our residents, and a residence in emergency medicine, was just a marvelous clinician, and is the living proof the fact that we can kind of all arrive at a pretty similar spot if we will commit ourselves to learning.
Yes. And understanding, not just know facts, understanding.
Well, Carrie Dutton, you are an absolute angel. Holy cow, you talk for 2 solid hours. Bless your sweetheart, without a sip of water or going to the bathroom. Good grief, thank you for coming again.
You're welcome.
I'm going to ask everybody who's still there, all 150 out there, to please put thank you, Dr. Dutton, in the chat and send it off, would you please? And Carrie, just take a peek at chat and watch them all come flying through. Kids all over the world who are saying thank you for these marvelous thoughts about humanity and commitment and self-preservation.
Yeah. And I thank your team for staying committed to this virtual shadowing and staying at this 18 months into it. I know it's a lot of work for you to ask people and hunt people down and organize this and look through our PowerPoints. And so I just want to say thank you, virtual shadowing team members from March 2020 to this very moment, for putting in the work that you guys have for the sake of pre-health students all over the world.
Well, thank you. Thank you, Carrie. And, the feeling is absolutely mutual. Kiana, do you want to show them the slide about the exam and all?
Sure. Dr. Dutton, if you don't mind skipping these next few slides.
Am I doing it?
Yes. Keep going.
Oh, there you go.
One more. Okay. Everyone, here is the quiz for assessment 78. It will be due next week, November 23rd at 6:59 p.m. Central Standard Time. As Dr. Fowler just said, please make sure to give Dr. Dutton just all love. She's awesome. We're just so happy that she was able to join us today. So thank you so much.
You're welcome.
Awesome working with you. And
the link to the exam is in the chat right now. also. Well, Kiana, thank you. And Carrie, God bless you. Thank you so much
Thanks.
for coming and sharing this wonderful, just amalgam of thoughts that lifted our hearts so much this evening.
And
Well, folks,
should there be anyone out there that knows they're interested in pediatrics and didn't jump into virtual shadowing all a year ago? My first episode was 25. Episode 25 is when I first talked about life in pediatrics, if someone is trying to hunt that down.
Thank you, Carrie.
Sure.
Well, again, Dr. Dutton, thank you for your marvelous talk. I want to thank the whole virtual shadowing team for the ongoing work that they do every week to hold this together. We're going to seriously reconsider maybe opening the old exams. We saw how many of you responded that you would like that. It's something we're thinking about. It's actually a lot of work. And so we're going to have to decide if that seems to be something that we can share the work to get it done, but we're going to seriously consider it. Anyway, thank you all. This, as long as you keep coming, we're going to be here. So on behalf of Dr. Dutton and our host, Kiana, tonight, and the whole virtual shadowing team, we want to thank you for coming. We wish you a marvelous evening and a good night. Thank you for coming.